Hi, everyone. It's my great honor to be invited as a speaker for SAI Asia. I'm Dr. Sang-Ju Lee from Yonsei Skin and Laser Clinic in South Korea. Today, I'm presenting 4D approach for enlarged pore. Skin folds are small opening present at the skin surface. There are two types of pores in the skin: invisible pores, invisible pores, and the visible pores. When we talk about pores, we are talking about sebaceous hair follicle. It is enlarged, empty, funnel-shaped structure. They are cylindric, honey-impacted openings of pillar sebaceous follicles. If you want to know more about pores, please read this article I have written in the past.
Hi, everyone. Am I audible and visible?
Yes, yes. Yeah.
Okay. So thank you very much for inviting me to SAI Asia. And I'm Dr. Atula, and I'm from India. And after that very nice talk from Dr. Lee, I will be focusing on mainly energy-based devices that I use in reducing open pores. So these are the treatments that I do, and typically what everybody does. We do medications like topical retinoids, topical salicylic acid, oral retinoids, anti-androgens. We use chemical peels. We use a lot of lasers like ablative, non-ablative, fractional lasers, Q-Swiss, Chiag lasers. We use energy devices, and we might use a combination of all of these. So let me focus now on my area, which is the energy-based devices that I use, which excludes lasers. This includes only RF-based devices that I use in my practice. I use monopolar radio frequency.
Hello, everyone. I'm Dr. Hui-Peng HUANG, a dermatologist in Taiwan. Today's mission is to talk about the pore size and Demodex. Here are my curriculum details. I am interested in Demodex since 2013, and our team introduced two methods to assess Demodex density. We assess Demodex density in daily practice using the thumbnail screening method TSM and superficial needle scraping method SNS. Demodex overgrowth is defined as Demodex density larger than 11 mites per square centimeter by TSM, or larger than 2 mites per 5 pasture by SNS method.
Yeah. Hi, everyone. Okay, so I'm going to talk about portion for pores. And my job is very simple because I think all of you has spoken, and I'm just going to maybe summarize everything. So what are pores? Actually, it's still not well defined, you know. Some people say between 0.3, some people say 0.6 millimeter. I think, to me, I accept it between that range. And we know there's, as Dr. Lee Sang-Ju there mentioned in this very nice article, increased sebum production and collagen degeneration around the hair follicles. So overview of my presentation, I'm just going to talk about oral and topical treatments. And fillers as well. I think it can be used, especially those collagen stimulating fillers. And finally, a bit about energy-based devices. Oral and topical treatments, we know isotretinoin works. All of us have agreed. And also topical retinoids is been proven for
and the depth, of course, in 3 passes, maybe so keep between 1.5, start from 1.5, 1, and then go down to about 0.8. That should be good enough. We don't need to go very deep with open pores.
Yeah, I agree. The depth don't need to, should be very deeply, just less than, I think 1.5, less than 1.5. Okay, thank you. And then the clinical photos of Dr. Huang showed us. It is very popular case in Korea. We can meet a similar case in many cases, but in clinical practice, many doctors don't do the dermoscopy because some doctors are very busy, and then I think it's very worthy to do testing of dermoscopy and the examination of Demodex and supporting the treatment with the medical treatment and the combination of the energy-based device and laser treatment afterward. Yeah. So
I see, Dr. Lee. This to Dr. Huang. I see quite a number of publications on Demodex, from Taiwan. As compared to other countries, I was wondering whether the environment plays a role in Taiwan that is commonly associated with even rosacea. I think a lot of publications on Demodex on rosacea, right, from Taiwan.